And joining us now in North Bay, Ontario, Alex Mantha, a third-year medical student at the Northern Ontario School of Medicine. Alex, it's good of you to join us on the line. How are you tonight?
I'm great, thank you for having me, Steve.
We're delighted to have you on the program because we want to find out more about this experience that you're having. The Northern Ontario Medical School, we will just explain for those who don't know, is a joint initiative of Lakehead University in Thunder Bay and Laurentian University in Sudbury. It opens its doors in 2005, and I guess I want to know, for starters, why you decided to go there as opposed to one of the medical schools down south.
All right, good question. The reason that I chose to go to the Northern Ontario School of Medicine, basically I'm all about hands-on learning. And the big attraction for me was the fact that it is in Northern Ontario, which is where I'm from. I'm from North Bay. And it offered me that hands-on learning from year one of the program.
So as a Northerner, it was important to you, presumably for hands-on, but also for other reasons as well, being closer to home maybe, to stay in the North?
Exactly. So basically, this program kind of offered everything I wanted it to. It had the hands-on learning. It's close to home, so I'm based out of the Sudbury campus, which is just about an hour and a half drive away from North Bay, which is where my family is located. So it gave me that opportunity to also spend time with family, but also kind of achieve the goals that I wanted to, which was going to medical school and becoming a doctor.
Sounds like a nice mix. Far enough away when you don't want them, close enough when you do need them. Something like that?
Exactly. It's the perfect mix.
Okay. How long does the program last?
The program is 4 years. Basically 4 years is kind of the standard length of medical school in Ontario. McMaster is a school that offers a 3-year program, so NOSM is kind of following the same idea as the rest of the medical schools in terms of length of program. So we're 4 years in length.
You just said NOSM, Northern Ontario School of Medicine, just so everybody knows the acronym. And how many students have you got enrolled in there with you?
In my class, we have 56 students. 2 years ago, they actually expanded the size of the class to 64 students. So over the past 2 entering classes, there is now 64 students based out of Sudbury and Thunder Bay, so a total of 64 students.
Now, NOSM calls their approach patient-centered through case-based learning. Tell us what that means. Okay,
so our program is basically taught to us by systems. So, for example, we're in first year, we start kind of by basic, kind of catch up on anatomy and physiology, and then we're into the systems. So the first system we cover is the gastrointestinal system. And the way that NOSM approaches kind of teaching us about this system is by teaching us the basic anatomy and physiology using lectures and lab sessions. But they also use a case-based approach. And what that means is they use kind of real-life cases. So a patient presenting to the emergency room with abdominal pain, and they give you certain information. And from that information, you have to kind of come up with a diagnosis in a way that you would approach that problem or that issue, so the abdominal pain. And these case-based sessions are delivered in small group learning. So there's about 8 students per group. We go over the case. You kind of bring the basic first ideas of the case home. You do some research about it. And then the second session is addressing how you would deal with it. So in that small group, you are kind of describing why you went with a certain approach, and you have colleagues to kind of support or negate the things you say. And there's also a physician that facilitates these sessions to make sure that we stay on track and are addressing the things that we want to or we should be addressing. And basically in that sense, it gives us the opportunity to practice real life medicine, what we will be doing when we graduate medical school. When a patient comes in, you know kind of how to approach the situation. So the cases are based on real life situations and allow us to kind of develop our critical thinking and the way that we would approach a similar case in real life once we're real doctors.
And how far away are you from graduating right now?
I'm in my 3rd year of the program, so 3rd of 4 years. So I'm 1 year away from being a real doctor. At the end of 4 years of medical school, though, you complete a residency program. So that residency program is basically a time where you explore a path of medicine. So family medicine, for example, you'd spend two years in a residency program and just kind of perfecting your skills and learning from doctors in communities about how to be a better family doctor. So really, I'm about 3 years away from becoming a family doctor if that's the path I choose.
So I can't call you Dr. Mantha yet, is that right?
Not yet. About a year away, I'm officially a doctor, but about 3 years away until I can set up my own practice.
Gotcha. Now, as far as I know, yours is the first medical school that has opened in the province of Ontario in the so-called digital age. So I'm wondering if, advanced technology plays some significant role in your education as well.
It definitely plays a significant role in our education. Because our school is divided into 2 campuses, Sudbury and Thunder Bay, we really utilize that technology. So when we have lectures, to make sure the material we are learning is the same in both sites, we use video conferencing. So the lecture is usually located in either Sudbury or Thunder Bay, and that lecture is broadcast via video conference to the other campus. So we're kind of, our classroom is a virtual classroom in the sense that it's joining 2 campuses from a significant distance apart. And without that technology, our program really wouldn't be able to function properly. And that technology is also utilized furthermore in 2nd and 3rd year, where you do placements outside of Sudbury and Thunder Bay, but still maintain that same type of routine. So you still need to attend lectures, you still need to do the small group learning, but that's done via teleconference.
Okay, let's talk about your placements, because I gather at the end of each year you've had to do whatever it was, 4-week placements or something like that in various locations, and that's all part of the hands-on training. So let's go through these briefly. The end of your first year,
Yep.
So 2 years ago, where were you placed?
I was placed in, so the placement at the end of first year is an Aboriginal placement. So it's 4 weeks in length, and the purpose of the Aboriginal placement is to expose us to the Aboriginal culture and to really let us know more about the Aboriginal culture and how healthcare is delivered in those communities. And that's because a big population in Northern Ontario is made up of Aboriginals. So I was placed in Sagamok, which is a community between Sudbury and Thunder Bay. And most of the time there was spent learning about kind of the traditional ways of Aboriginal people and how they use traditional medicine to supplement Western medicine now. And that placement was a fabulous placement. I learned a lot, and the community was very welcoming. And some of my classmates also had the opportunity to go to some more remote areas, so some flying communities up north, such as Big Trout Lake. And again, had just amazing experiences up there with the population, the Aboriginal population, and really got to know that population so we can provide culturally appropriate care. And
well, that's what I was going to ask, Alex.
It was an amazing
You talked about culturally appropriate care. Does that mean the kind of things that you would see in terms of medical problems would be different, say, in an Aboriginal community than in the rest of the province?
Yes, so it's well studied that Aboriginal communities have different health issues than the rest of the population. So by experiencing it firsthand and seeing how those problems are addressed, kind of the typical Western way, but supplementing it with traditional medicine, we really get to see firsthand, how we need to treat this population and what we can do better to treat this population.
Okay, end of second year. What did you do for placements then?
So in second year, there's 2 placements actually. So there's one at the beginning of second year and one at the end of second year. So my first one was in Hearst. It's 4 weeks in length. So Hearst is a Francophone community north of Timmins. And there, the focus was more on kind of interacting on a more clinical level with the population. So it's basically based on giving us exposure to the medical field in a rural area, so knowing how to practice medicine with limited resources. Hearst also is, like I said, a Francophone community, so it gave me the opportunity to interact with the Francophone population of Northern Ontario as well. I'm Francophone, I can speak French fluently, so it gave me the opportunity to practice my French skills and make sure that I can communicate in Francophone, in French, in the first language of Francophones, to provide, again, culturally appropriate care.
And your placement at the end of that second year?
My placement at the end of second year was in Sunridge, which is 45 minutes outside of North Bay, so not too far away. But again, it's a small town with limited resources. They don't have a hospital there. It's just a family medicine office, really. So it was kind of dealing with, or kind of exploring the scope of family medicine and really what could you deal with in that small community with limited resources. And really these experiences test your knowledge and really push you to learn more and expand your knowledge. And they also allow you to get to know the population you're in, so the communication or the community you're in, and really explore that.
Okay, so we've gone over first year, second year. You're now in the midst of third year, I guess almost coming towards the end of third year. What's the placement been this year?
Okay, so third year of the program at NOSM is called the Community Comprehensive Clerkship. So what that means is you take, as a student, you spend 8 months in a community other than Sudbury and Thunder Bay. So for me, I got my hometown of North Bay. So I'm now in my 6th month of placement, and you're assigned to a family doctor. So most of your time is spent in family or primary care. And with that, the goal is to really hone in on your basic skills. So your history taking, your physical exam skills, and really be able to provide continuity of care. So you see someone in the office, you can see them in the hospital, you're really following them through their care through the healthcare system. On top of that, we also get to spend time in different specialties as well. So I've had opportunities to spend time in general surgery, anesthesia, pediatrics. So you get to explore a lot of those specialties as well, which allows you to just kind of perfect your skills in those areas as well. Again, we still have to address the core curriculum. So we still have lectures, we still have small group learning, that type of thing, to make sure we're current on just healthcare and medical issues. But it's really, third year is to enhance our clinical skills and our patient encounters and make sure that we really know those skills well.
And do you know what you've got on tap for fourth year placement?
Fourth year is back in Sudbury or Thunder Bay, so I'm going back to Sudbury, and you spend 4 weeks in a lot of the major disciplines. So I'm spending 4 weeks in internal medicine, 4 weeks in general surgery, and kind of all the way through. And you also get to do electives outside of NOSM. So you can do electives basically anywhere you want in the country. So U of T or UBC, in whatever field you want, and really get to explore your career options. So I've booked a couple of electives at other schools, hoping to figure out what I want to do for the rest of my life. But yeah, fourth year should be just as much of a challenge as third year.
Alex, of course, let's just review the reason why the Northern Ontario School of Medicine was created in the first place, and it was to, I guess the thinking was, if you train doctors in the north, they are more likely to stay in the north, because at the moment, or before the school was created, training doctors down south, they might go and do some locums up north, but then as soon as those placements were over, they'd be coming back south. So here's the key question. You will have been trained in the north. You are from the north. You will have spent a lot of time getting educated in the north. Are you going to set up your practice eventually in the north?
I would love to have the opportunity to come back to Northern Ontario and open up a practice and really give back to the communities that have provided me with the education that I wanted. So if everything works out, I would love to come back and practice in Northern Ontario.
You know, the great fear is that people will be trained in the north, but then want to practice on University Avenue in downtown Toronto anyway. Can you say that that's not in the cards for you?
True. I don't think that's in the cards for me at this point in time. I love the community of North Bay. I love Northern Ontario. And being able to spend this 8 months in North Bay has just kind of confirmed for me that I would love to come back to North Bay, if that's possible, or somewhere else in Northern Ontario. So kind of making those connections here. This year I've met numerous amount of doctors. I've met community members, and everyone wants doctors. They treat you with such respect and really appreciate your role. So if everything works out for me, I would love to come back here, but we'll see.
How old are you, Alex?
I'm 24 right now.
Ah, to be so young and so talented. You've got so much ahead of you. How exciting is that? Alex, it's awfully good of you to spend so much time
Thank
with us
you.
on TVO tonight. Thanks so much and good luck, and we hope it all works out for you.
Great. Thanks so much for having me, Steve.
Alex Mantha, third-year medical student at the Northern Ontario School of Medicine. She joined us from North Bay tonight.
Support Ontario's public television. Donate at tvo.org.